Hey guys, Dr. Ben here, F8 Well Centers. Let's talk about blood work today. This is such a crucial part of getting a good diagnosis. And so many of you are sitting out there thinking, oh my gosh, where do I start? What do I do? I don't feel well. How do I get better? So here we go. Let's get into it. For all of you guys jumping on, pop down below where you're watching from. Love to see you guys all over the country, all over the world. And also, let me know what blood work you've had run recently. Let me know when the last time you had a blood test done was, and who reviewed it, and what you found, what you changed with it. Because really, if you're not changing, if you're not making a shift, if you're just looking at it and going, well, it's okay. My doctor looked at it, said everything's within range, or give me a thumbs up if any of you guys have heard that. Oh, I just had blood work done, and the doctor said everything's fine, everything's within range, or your cholesterol's a little high, eat better, lose weight, you're going to be fine. Has that ever happened to you guys? It happens a lot to our patients. They come in and they're getting those same feedback. Hey, Melissa in Ohio, good to see you. So pop down below where you guys are watching from. Share this with anybody that you know that needs blood work done, that needs help with their health status, and that is definitely going to be a great thing that you're going to be able to share. Give them this knowledge. So blood work is the foundational piece. When we start talking about functional medicine, when we start talking about getting the body healthy, figuring out why we're out of balance, you've got to start with blood work. Jennifer had her daughter had hers run heart screening through school, just cholesterol and HDL. I'm not sure how much emphasis we put on blood work at such a young age, but thought I'd share. Cholesterol, and we're going to get into that. That cholesterol doesn't really tell us a whole lot. It's really not that huge of a thing. Happy Mardi Gras from Louisiana. Oh yeah, it is Mardi Gras Day. Tomorrow's Ash Wednesday. So here's the deal, guys. You or a loved one do not feel well. We've got a 34-year-old coming over today for a new patient, and we're just reviewing the chart. She's got anxiety. She's got ulcerative colitis. She can't lose weight. She's stressed, tired, all of these things, and only 34. And yet, she's been down that route. They've scoped and scanned and gone up from both ends and met in the middle, and they've looked at the gut and put her on prednisone and immunosuppressants and all of these different things. Hey, Linda, great to see you. You too, Paula. Hope you're well up there, enjoying the warm week. And so, all these scans, all these different things, and they're still, not feeling very well. Tried medications, tried all these different things. But here's the deal. When they looked at the blood work, one, they did not do an in-depth enough evaluation. You've got to throw the net wide, and you've got to look at all types of different markers, and then you have to narrow it down. So wide and then narrow, and you narrow it down to what the healthy range should be. And this is the crucial part with blood work, is that you've got to look at it from that optimal range. So there's this bell curve. If you guys have taken statistics, you remember hearing about this bell curve. And so you've got that average person coming into that lab. Vitamin D, this is a great one. The lab we use, 30 to 108 is where they say it's an okay range. And so if you're at 31, you're fine. If you're at 107, you're fine. But if you're at 29 and 109, then there's a problem. So that's the big thing that we're looking at, is we've got to go through and figure out one, which of the blood tests we need to be testing, but then narrow it down. So 30 to 108, we like it 60 to 80. So go ahead and put down below what your guys' vitamin D level has been at your last test, and I'll let you know if you need more or less in there. So narrow that vitamin D down. 60 to 80 is optimal. And a lot of people, I always say BC, before COVID, when people came in 25 to 35 on their vitamin D blood test. Now I see a lot of people 40 to 70, because so many people are listening to me and other doctors out there that are telling them, get their vitamin D up, take your vitamin D, huge for immune system, all those different things. Hey, Mac in South Africa, good to see you out there as well. I don't know what time it is in South Africa. Anybody know? You can Google that for me, or Mac can respond. Greg, your vitamin D was 28. This is a perfect example, Greg. 28 is going to be low in the lab range, but if you were at 30.5, it would be totally fine, and the doctor could just slough it off and go, hey, your vitamin D is great. You don't even need to take any. So at 28, most people in the 20s, they're going to need to take 10,000 IU per day to get up into that 60 to 80 range. You want to double check it. If you are taking that amount, check every 3 months, make sure it's not getting too high. Hey, Mac, having tests on Wednesday, suspecting polymyalgia testing, proteins, glucose, vitamin D, protein, inflammation markers, and cholesterol. Do this for me as well. Mac, if you can get ferritin tested, get ferritin tested, and also get your GGT tested, as well as get your insulin tested, and go in non-fasting. So that is a crucial part of our blood work, and what makes us different than everybody else out there with blood work is we're going to be looking from this non-fasting state. So we can pick out insulin resistance, we can pick out reactive hypoglycemia, all types of different things. So that's a huge part of the puzzle, is to be able to figure out which markers we want to, oh good, insulin as well. Yes, Max, so go in, even if they tell you fasting, go in non-fasting. Mindy, great job, 62 on your vitamin D. You're probably taking 5 to 10,000 on that one, so good job. So blood work is the foundational piece. Yes, we do brain maps, and we do in-depth exams and these 20-page questionnaires and all these things where we can get as much information as possible, but ultimately you've got to have that blood work figured out. So here's the next step then. You've got to know what else you need to get tested. So you've got your simple CBC, which runs your immune system markers and looks for anemia and some of those things. Your CMP, which runs your liver enzymes and electrolytes and some of those. But you've got to know what you're testing for and run the whole gamut. And so here's the deal. These are the top markers that you're probably not getting run that you need to be running. So write these down. Next time you go to your doctor, just like Mac is, you need to get these run. You need to get ferritin tested. Lots and lots of doctors are going to check your iron, and that's fine. Iron is blood iron, but that can fluctuate a whole lot. What you want to test for, even more important than iron, is what is called ferritin. Ferritin is stored iron. I always say, if there was only one test that I could run on everybody, it would be ferritin. And that's because if ferritin is really low, we just had somebody yesterday at 13, she's got some type of anemia, probably losing blood in the digestive tract, leaky gut, malabsorption, things like that. If ferritin is high, 125 for women, 150 for men, anything over that, then that is an inflammatory process. 99% of the time, their triglycerides are going to be high, liver enzymes are going to be off, insulin resistance is going to be creeping in, all of these other imbalances. So we've got to get that ferritin tested. That's going to be one of the first ones. So number two is going to be you want to get your GGT tested. So Mac put GGT in there as well. AST and ALT are two liver enzymes, and those are fine, but GGT tells us about what we call fatty liver. And if your GGT is over 20, you're creeping into fatty liver, and you need to get your blood sugar stabilized. Again, 99% of the time, that is a blood sugar issue. Sure, if you're drinking 6 to 8 drinks a night, you could be getting fatty liver, that GGT could be going high, but you've got to be figuring out if it is high, you've got to get that blood sugar stabilized. That's why we use continuous glucose monitor with every one of our patients, so that we can know exactly where that blood sugar lies all day long. So GGT. Number three, we already talked about this with Mac, you want to do a non-fasting insulin. So many people want you to come in and do your blood work fasting, but that's not real world. 12 hours, let's not eat. Okay, well, your body can acclimate, but what I like to see is non-fasting, because that will show us somebody's insulin might be fine, but it's going to spike up and it's going to be way higher if they're having issues with that blood sugar, as well as that non-fasting glucose, I'll see people all the time, there'll be reactive hypoglycemia, meaning it's crashing down after eating. So Patricia, so you don't need an ultrasound to determine fatty liver disease. Yes, so Patricia, if you truly want to diagnose somebody with fatty liver, absolutely, you need to do an ultrasound, CAT scan, some type of scan to see if it's fatty liver. But what we do know is if GGT is on the rise, especially over 20, you trending towards that fatty liver. But of course, the only true way to know is to actually do that scan. But here's the deal: we know that so many people are going to be dealing with fatty liver because of their blood sugar imbalances, and it's really rampant in today's day and age. But yes, great question, Patty there. And then Penny, CBC, BNP, lipid panel, CRP, ferritin, vitamin D, magnesium, and UA, ferritin. Yeah, so here's the deal, Penny. Your serum ferritin should not be over 125 as a female. Your C-reactive protein should not be over 1. So CRP is another marker that you want to look at, and that CRP, if you're over 1, you got inflammation. If you're over 3, you've got a lot of inflammation. So if that's all I saw was just that ferritin high and that CRP high, I would say you're inflamed, your liver is stressed, you've got high blood sugar, if not high and low fluctuating blood sugar. So there's a lot going on just from those 2 markers, Penny. I guarantee your body is not in a healthy state right now because of that. Good, Mac, doing that non-fasting. Paula, how often should I do blood work? So Paula's worked with us in the past. So anybody like that, for you, Paula, I would keep on it on a 6-month basis. That's a really good range for people that are still working on a few things. If you're in really good shape, like I just did a 12-month. I've been working on some stuff, but I know that we went from 1 office to 4 offices in 9 months. Went from half a dozen team members, now we're up to 25. So we've got a lot going on, and so I wanted to check my adrenals, hormones, some different things like that. But I went out about 12 months, but Paula, I would say 6 months for you. If you're actively working on different systems, that's going to be good. It's also a good way for people to stay up to speed and go, okay, hey, I need to be active on this, and really keep motivated. So yeah, I think 6 months for you would be great. And then Amy, 82 non-fasting here. I'm guessing that's glucose. Is what you're talking about, Amy. 85 is my cutoff. So whether you're fasting, non-fasting, eating, not eating, sleeping, whatever it is, 85 is that cutoff. So I'm guessing, Amy, that it was probably even going to go lower than that. I wouldn't be surprised if you do get some hypoglycemia and you have some crashes. That's going to be tired, spacey, hangry, just not quite as much blood glucose as you should to the brain, and just not as consistent as you need to. You could have gone up and then crash down. That's the great part about doing that CGM. Can I still do blood work through your office? Absolutely, great question, Paula. So Paula's up in Wyoming, and we can drop ship the blood kit to you, Paula, and you can just run over to Casper or any of the hospitals and get that drawn. You can come down to the office if you're down this way. But for any of you guys out anywhere in the country, even up in Canada, we can drop ship the same kit that Paula used when she was going through our program. We can drop ship that same blood test kit to your door. You get it drawn, mobile phlebotomist, local lab, local hospital, anything like that. And then we will, it gets shipped to the lab. We will review that. One of our F8 doctors, highly trained in blood work, they're working every single day with patients in the office or remotely, and they're going to review that with you and let you know exactly what's out of bounds. This is the exact test that I just ran ran. My wife on last Tuesday had hers tested. It is the exact same blood work that we do ourselves, we do with our patients, and you can get that shipped straight to your door, just like Paul is going to. So if you've got any questions at all, pop down any numbers that you have as well, even for you guys watching this later. We'll keep an eye on the page and we'll let you know what numbers you need to be looking at, any changes that you need to be doing, because this is the foundational piece to functional medicine, guys, is to get these numbers figured out. So thanks for jumping on. Love having you. Share this with anybody that needs this information, and you guys have a great day. Nicole, Brittany will send you a direct message, and we will we'll get that drop shipped to you. All right, take care, guys.